And so I wanted to have an update from you, Mr. Mejia. What is it that is happening? Are we heading in the right direction? Are we heading in the wrong direction? What's going on in Sonoma County with COVID?
We are absolutely heading in the wrong direction, sadly, Rafael. As of today, we are having 17.9, almost 18 cases per day per every 100,000 inhabitants. Out of those numbers, 36.4 are for the unvaccinated people and 8 are for the vaccinated people. We're seeing a widespread increase on the spread of the virus, presumably the Delta variant. We're not very sure yet because we're still depending on the state level to get the numbers. But as of August 2, I can tell you that we have 242 cases attributed to the Delta variant. The Delta variant is 60% more transmissible, and it carries 1,000 times more the viral load of the original strain. That explains how infectious it is and how fast and easy it is to be transmitted. And it's for this level of spread, dangerous spread of the virus. We have 61 persons in the hospitalized because of COVID, any of the variants. Presumably is Delta because of the speed that these things are happening. We've been averaging 42 people in the hospitals per day for the last 2 weeks. For whatever reason, they hit the hospital with very bad symptoms. And 21 persons are in the intensive care unit, and 50% of the patients in the intensive care units in the 6 hospitals of the county are COVID patients. So that is reducing the possibilities of hospital beds in the intensive care unit for any other patients for any other reason. That's not going in the right direction. We have 331 deaths now. 99.4 of those deaths are non-vaccinated people. As a result of all of this situation, Dr. Sundari Mays, our health official in the county, has issued several orders. The first one on Monday, this past Monday, August 3rd, where everyone in Sonoma County must wear masks in public places, with limited exceptions to combat the growing spreading of COVID-19. Sonoma County joined the rest of the county, most of the counties in the Bay Area with this request that includes vaccinated and non-vaccinated people wearing masks to the indoor places. And then yesterday, there is an extension of this health order for asking all fire, law enforcement, and emergency medical services and workers at disasters shelters to show proof of vaccination. If not proof of vaccination is available, workers will need to undergo COVID-19 test. It will go into effect on September 1st. And this is an expansion from the California Department of Public Health that required congregated healthcare and facility personnel to be vaccinated or evaluated if not vaccinated. Dr. Mays also extended a policy for the rest of the people that work in the county, like me, that's close to 5,000 people, to do the same, to prove that we have full vaccination or else take COVID tests in weekly basis. And at the same time, she made an emphatic recommendation for all employers to adopt a similar policy. Dr. Mays is strongly recommending that all employers require workers to provide proof of complete vaccination against COVID-19 as a condition of employment. And workers who are not fully vaccinated or who refuse to show proof of vaccinations should undergo weekly COVID test. So it's a dire situation. It's not where we want to be, but it's in our hands to change these numbers. It's really in our hands. The resources are out there. The vaccines are safe, are free, are everywhere. You can even pick what vaccine you want. And people who cannot leave their house can have the vaccines at their home. So there's no real excuse. As I started this conversation saying that, we have been vaccinating for 8 months. The vaccines have proven that they protect you. And even if we still can get infected with the virus, we have the chance, 99% not to get severe symptoms or go to the hospital or die because of COVID. So people need to think about this, because the most affected people is the unvaccinated people. So it's time to act and change these numbers for the sake of all of us. We don't want to go back into the fall or the winter the way that we did it in 2020. We don't want to go there. So please act, get vaccinated, and do it soon.
And that's the issue, right? That we need to, the idea here was, let's make this available to everybody. Well, the vaccine is available to everybody now, but people have to choose to do so, or at some point, hopefully, the FDA will approve it. And as a result of that, it can become mandatory for people to, to have to take it, to be able to get back to school, all of that stuff. And so, as always, thank you for the update. I hope people listen to the message that you're bringing to us, and as a result of that, make the necessary decisions. And again, whether you're vaccinated or not, wash your hands frequently, practice social distance, and as always, again, wear your mask. If you're gonna be outdoors and there's people nearby, like when I take my walk every day, if in case I run into other people, I don't know if they're vaccinated or not, I wear my mask, because that way I lessen the chances. I get back home, I wash my hands. Again, it's all about not ending up in the ER, because whether we are vaccinated or not, some of us are more susceptible to this. And with that, I want to thank you again for taking the time and being with us today. And I look forward to our next conversation next week on Thursday.
I'll be here on Thursday, Rafael. Thank you very much.
Thank you. Take care.
Bye.
Bye-bye.